Hey, we're back with you. We have Sammy Leach here with the North Carolina Navigator Consortium. And so that is a group of experts who can help you figure out what your health insurance should be. So in case people missed it at the very beginning, what is the North Carolina Navigator Consortium?
We are a federally funded organization. Our sole goal is to make sure that you have enough information to pick a qualified plan for you and your family.
Okay, and so all the people that are behind us right there, those are the people who you are talking to one-on-one, and you have the opportunity to get them on the phone until 6:30 tonight. The number is there on the side of the screen there, 855-733-3711. All right, so Medicaid expansion just happened.
Yes.
If folks are thinking to themselves, I'm not really sure if I qualify for Medicaid, what would you tell them to do?
Give us a call. Check out our website. We can check your eligibility. Because it expanded to cover 600,000 people across the state, you may have been denied Medicaid the year before. You should check again. You should apply again, because it's possible that you could. If you're between 19 and 64 and up to a family of 4, if you make $41,400 a year, you could fall into eligibility.
Okay, so Medicaid is just one of the things that you can ask about. The ACA enrollment is the other thing that you could ask about. The deadline is coming up. What kind of information will people be asking on the phone when they say, all right, how can I help you get a plan?
Well, the number one question I usually get is, what do I qualify for? Do I qualify for any subsidies? Do I qualify for any help paying my premium? And 9 out of 10 North Carolinians, that's 90%, do qualify for some type of subsidy. So that's why we're here to answer the questions and see if, and set you up with a free appointment to see what you qualify for. It all depends on the information that you bring us when we set you up for a
Speaking of information, what kind of information should you have at the ready?
You should have your income information, your tax information, and that could be history of yourself and whomever you want to add to your plan. It could also be the history of your children or your spouse. But bring that information to us and we will take that information and get you the best information we can.
Because you need dates of birth for sure.
Dates of birth,
if people have specific prescriptions, you need to have that at the ready as well, so that they can check in their database to see which plan actually covers what.
Absolutely.
Okay, remember, these folks are here until 6:30, so do not miss out on getting them to help you with your health care. We're going to share a story that I did just recently, sharing what North Carolina's largest insurer recommends you do during open enrollment. And don't forget, you need to call that number on the bottom of your screen to get your Medicaid and ACA Marketplace questions answered. While October 1st is looming large, the next big date to look at is November 1st. That's when enrollment begins for health insurance through the Marketplace. This year, there are 8 companies doing business in North Carolina through the Marketplace. Now, 5 of those companies have submitted proposals with premium increases. 3 companies submitted decreases for monthly premiums, and get this, one of those companies has been approved for a decrease. It just so happens to be the company with the most customers.
Blue Cross has officially hit the market and said that they are given a 4% decrease in premiums. Right now, it is projected that Blue Cross has approximately 358,462 members enrolled in Marketplace plans, which is actually making them the largest carrier in North Carolina.
Blue Cross Blue Shield of North Carolina will be offering health insurance plans through the Marketplace with a 4% premium reduction. Price is important, of course, but the real key is to double check that whatever plan you choose for next year, that your primary care doctor or whatever physician you see most is still in your network. Now, what if you get health benefits at work, but you'd rather just get Marketplace insurance, maybe cash in on that Blue Cross deal?
That's where we're getting into a little bit of a tricky situation, because we have a formula that we have to work out and make sure that your insurance through your employer is deemed not affordable.
Probably not going to happen for most of us. In the next month, we should get confirmation about the other companies that could be offering a decrease in premium rates. In the meantime, you need to mark your calendar for November 1st.